Aloha kakahiaka kako. Aloha. Welcome everyone to Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning. Happy beautiful Aloha Friday. Just a friendly reminder, today's talk story is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. We are also on Facebook, Instagram, and Twitter. Please follow us to see a lot of content, upcoming events, get to know our team, our supportive community members, and also hear patient stories. If you are following us, send Lonnie and I a comment, a heart, or a shaka. We would be so excited to connect with you. For those of you joining us on Zoom, the bottom of your screen should look like this. Please click on the chat box and say aloha and let us know where you're joining in from. Today's healthcare talk story will be diving in and discussing why the disadvantaged and most vulnerable population do not get the care that they need. You may ask questions throughout the presentation by clicking on the Q&A box at any time to submit your questions to our speakers. For those of you watching on Facebook Live, thank you so much for joining us and aloha. Please use your comment box to say aloha and let us know where you are joining in from. Feel free to chat in questions, share your reactions with us during this talk story, even share this live video with your friends and family. We love to see the hearts, the thumbs up, and even the care button. For those of us on Zoom, we are doing polls today. Facebook Live participants, you will not be able to see the polls pop up. But again, we want to hear from you using that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Email me, lopez@hawaiicarechoices.org. All right, so polling is very simple. A brain teaser bell will ring. Just like that. Question's going to pop up on your screen. Make the selection you think is best and submit your answer. Oh, I'm going to go ahead and launch that icebreaker on your screen. How was your New Year's celebration? This is our second healthcare talk story in 2023. And if you haven't joined us in January, we want to hear, how was it? There was also Chinese New Year, so kung hei fa choi to everyone. Was it quiet? Was it loud and explosive? Full of traditions for good fortune? Again, please put it in the chat box if you guys also attended the Cherry Blossom Festival that happened, I believe, last weekend in Waimea. I didn't get to go, but I seen beautiful pictures from friends. So go ahead and enter that right in there. I'm going to end the poll and share the results. So 62% of you said quiet evening inside, 23% said loud and explosive, and 15% said full of traditions for good fortune in 2023. Awesome. Thank you so much for engaging in our polling. And it's super duper easy. I knew you guys would get it. All right. So first I would like to change my screen. I have my technical difficulties over here. I'd like to introduce our speakers today. We have Lonnie Weigert of Hawaii Care Choices, striving to raise the awareness about palliative and hospice and bereavement care in hopes to provide a world-class healthcare choices and solutions for all. Please give a warm welcome to Lonnie Weigert. Aloha, Lonnie.
Aloha, aloha, and welcome everyone. Thanks so much for joining us.
Our special guest this morning is Lisa Shiroma, Chief Administrative Officer since 2015, overseeing radiology, imaging, housekeeping, laundry, pharmacy, and outpatient clinics. Lisa started her career at Hilo Medical Center in 1997, working in various roles in information systems, public relation, and nursing administration. She earned her master's degree in healthcare administration from Loma Linda University and her bachelor's degree from University of Hawaii at Hilo. She's also a member of Hawaii Island Chamber of Commerce and resides in Waikea with her husband and extended family. Aloha, Lisa.
Aloha, thank you.
This morning, Lonnie will be talking stories about palliative care, and Lisa will share the priorities offered at East Hawai Health Clinics in Hilo, Kea'au, Pahoa and Ka'u to bridge the challenges of access to care and what steps they have taken to help those living with serious illness get the care that they need. I am so excited for you all to be here today. And I'd like to start by asking Lisa, Could you please tell us about the East Hawaii clinics, where they're located, and are you guys taking in new patients?
Well, thank you for allowing me the opportunity to be a part of this talk story today. Yes, I'd love to share you some information about our clinics. We have, perfect. Thank you so much for bringing up that slide. So we have multiple locations, five different locations throughout the east side of the island. We have our 1190 location, which is located right in the footprint of Hilo Medical Center. So we have multiple clinics right in the hospital. So in the 1190 footprint is what we call it. We have a wonderful group of primary care physicians, and we also have a residency program here training future primary care providers. So this is just a screenshot of all the different providers we have and faculty members we have in that clinic. We also have a pediatric cardiologist in there, and here we go. We have pharmacists and we have nurse practitioners who are a part of that care team. And the next slide. Also within our 1190 footprint, we have a cardiology team, and it has grown from one provider to 6 different providers now in that clinic. We initially started with general cardiology, and we have launched an interventional cardiology program. So we're really able to take care and keep save lives and keep patients on island, which I think is an amazing thing. And over the last couple of years, we've added gastroenterology into that footprint as well. So we know that there have been a need for gastro providers. So we've hired 2, Dr. Kind and Dr. Ravella, to join that team. And we have pulmonology, and Dr. Belyev just joined our team about a year ago. We have interventional radiology and neurology. We can go to the next slide. So that's our 1190 footprint, and right across the street we have a new build. We have our cancer center, and upstairs we have what we call the 1285 clinic. Again, a lot of these clinics, they have primary care as their main focus because we're part of a rural health clinic. So we have 4 different providers in primary care. We have our ENT specialist. Many people know Dr. Savnani. She's been around for many years. And then we have OB/GYN services, and we also have urology. We can go to the next slide. And then on the downstairs, we have our cancer center team. So right now we have 2 radiation oncologists, and then we have a team of medical oncologists and nurse practitioners. We're currently in recruitment for more providers to increase the services we offer for our cancer center patients, because we have so many cancer patients, and we need more people to be able to help provide care to our patients. So in April of this year is when I think some of you who've driven by that area, you see a brand new building coming up. So in April of this year, we're going to be moving our cancer center. It's sort of outgrown its footprint. It's very tight and squishy in that area. And so we'll be moving to the new building, and it's going to be a really nice, pleasant experience for our cancer patients. And then down the street, we have our general surgeons. Dr. Lau just joined us a few months ago. So now we have 5 general surgeons, and we also have our vascular team who is off campus. Once we get that new building up and functional, actually our general surgeons and the vascular surgeons will be moving on campus to that new building and joining our team here. So those are the clinics that we have right in or very close to the hospital. But we also have locations outside of the Hilo footprint. So we have a clinic in Kea'au. They just opened up a little over a year ago, and they offer both primary care and urgent care services in Kea'au. They're a very, very busy urgent care clinic. And these are the providers that are there right now. And then we have our Pahoa clinic. So Pahoa, we also offer urgent care and primary care services, and this is our group of providers as well. And then we have a psychologist as well out in Pahoa. And actually we have a psychologist, Courtney Sen, in Kea'au as well. And then our last clinic is in Ka'u. So we have Dr. Shrestha. It's the Ka'u clinic is actually located in the Ka'u hospital. And they have a pretty big panel of patients out in the Ka'u area. So that shows that we have clinics all across the East Hawaii region.
Thank you so much, Alicia, for sharing that. Are all of these doctors receiving new patients?
Yes. Yes, all of our clinics, especially our primary clinics, they welcome new patients. We like to, and we take all insurances. So Medicare, Medicaid, we'll see all patients.
Okay, wonderful. Thank you so much for that. All right, I'd like to hand the virtual microphone over to Lonnie Weigert on understanding palliative care. Hi, Lonnie.
Hi, thank you so much, Tish. Wow, that is amazing, Lisa, how many people you folks have and that you're looking for more. I'm really, really excited that we have so much care offered to our community now. I'm just really excited, and I'm happy that you're here to update us that all of those doctors are still taking new patients. So that's wonderful. People can finally find their medical home somewhere in East Hawaii. That's wonderful. So for everyone that's on our Zoom this morning, thank you so very much for joining us. I wanted to quickly kind of share about palliative care and how everyone out in the community is not really aware that there is such a thing called palliative care, which is actually a specialized type of care, very similar to what the oncologists and all the ologists that Lisa just shared, very similar to their specialized care as well. And palliative care is a very broad umbrella, but many people are not even aware that we have it or that what it means. So actually, to palliate means to ease, to alleviate, to relieve, and to soothe. And oftentimes palliative care is quite effective when somebody is dealing with a serious illness and they have treatments such as radiation or chemotherapy or dialysis or even surgery. And there's naturally a lot of discomfort that comes from that. So palliative care is definitely more than routine care. Many times the physician may not bring it up. So we share this because if there is a family member or yourself that is dealing with a serious illness, we want you to definitely know to ask for palliative care, because Hawaii Care Choices is definitely a provider of palliative care, and we are caring for people all over East Hawaii in their homes that are living a robust life with a serious illness.
Lisa, I had a question. What are some barriers and or disparities to getting quality healthcare and disease prevention in our rural communities?
I think one of the biggest barriers in this community is just the lack of resources that we have for our patients. I think it's even harder the farther you get from, say, in Hilo, we have specialists here. But if you're looking at, as a patient goes farther or they live out in Ka'u, they may have issues with lack of transportation. And just to get to see a cardiologist, if they have, say, congestive heart failure, they have to coordinate transportation to get there. So I think one of our biggest barriers is just we don't have a lot of services throughout the island, and then when we do have it, sometimes it's difficult for those patients to even get to the services that we have here. So I know even for Ka'u, they have to coordinate transportation, and that's one step, right? And then they have to actually travel, and sometimes it could be an entire day just to go and see a provider. So a lot of people will not seek care because it's just so hard to get that care.
Yeah. Well, it's so nice to hear that Ka'u definitely coordinates care to all of the people out there and just as a resource. So thank you for sharing that. Back to you, Lani.
Thank you so much, Lisa. Yes, we agree that the access to care sometimes is probably the most challenging, and just making people aware that these challenges, such as just getting transportation to get to the doctor, is something that's very real. The more that we become aware of it, the more that we can rally together as a community and just really help our community get to the care that they need. So the benefits of palliative care, I was sharing with you that palliative care is a very large umbrella. One of the subsets of palliative care is hospice care, and I'll cover that in a bit. But I wanted to share that for people that are living with a serious illness, there's still the possibility and potential of living a very active life still. However, early admission is definitely the key. And I find that a lot of times people will wait. We're not really sure if culturally, that's why we wait. Like we're just saying, oh no, we should just wait. But I want you to know that waiting doesn't help. It's better to just come on in and or even calling us direct so that we can contact your physician to help you figure out what's the best plan of care for you. But for the most part, you know, when it comes to a serious illness, the physician has a very clear reason or purpose, and that is that the physician is really trying to help cure the disease, whatever it may be. The palliative care team comes in to focus importantly on the patient and the family. And so things such as the emotional side of an illness that make people uncomfortable, such as, you know, they're afraid, or they have anxiety, or there's depression, or all of those are things that the palliative care team can come in and really help with. And so it's important to understand the difference of palliative care, which comes at a very early time in the disease process, because it is consultative in nature, meaning we're not going in the home and putting our hands on the patient and doing wound care or anything like that. We're coming in and providing education and guidance for not only the patient, but for the family, because we understand when patients go to see their physician, they're probably in there maybe less than 10 minutes. And there is probably more questions that a patient may want to ask, but is maybe hesitant to ask, or might not even think about asking. And that's why the beauty of a palliative care team is to have somebody go in and be the advocate for you. And we've had situations where we have a patient over at the East Hawai Oncology Center, and the patient is going in to see Dr. Likova, and is there with their adult daughter, who is a caregiver, and just is not clear about all the different things that they want to ask the physician. So our registered nurse that's on the palliative care team could go in with the patient, and has actually done that in the past, where I'm in the lobby with the patient and our registered nurse is asking, okay, what is our game plan today? Do you want to share this, that, etc.? And what ends up happening is that, you know, our nurse can go in and speak with the patient to help them convey concerns that they may have at home. And it's so beautiful, because when I see the caregiver and the patient come out of the office, they are completely elated with the idea that their concerns were conveyed, they were communicated clearly, and now the nurse on our team is able to take a family meeting for them at home to explain to everybody what the situation is with their mother. And in this particular case, the mother was given quite wonderful news by Dr. Likova, which was that the tumor was shrinking, and that it looks like she was going to be cleared of the cancer with only another treatment. So in any case, that's why I'm saying there's a lot of other benefits about palliative care that people had no idea. And without that education, oftentimes people will go to the emergency room largely because they have anxiety and they just didn't know that all they had to do was something quite simple at home. And so we really do encourage people to access this kind of care.
I think it's important too, because you're right. That's when the patient's anxiety level is at their highest. So sometimes they may not be prepared for that conversation or be able to retain the information that's being given to them at that time. So if you have a supportive person with you who can, you know, educate back in the home, I think that's a better time for them to really digest all that information that has been given to them at that time.
Yeah. Yeah, so it really does make a lot of sense too, because with palliative care, a lot of times, because people are dealing with just the idea that they may have cancer or some really serious illness, and they're afraid. Now they're scared, so they don't know what to ask for. But when the palliative care team comes in, they'll really immediately go to what the goals of care might be for the patient. And that all comes out when we're asking what's important to the patient, what are their life goals, and all of it comes together, particularly making sure that they don't get treatments that maybe they don't need or they can't afford or they don't want. We had a patient that was a newlywed, 21 years old, just starting out her life, wanting or already starting to become a doctor, and she found out that she had cervical cancer. And then her doctor immediately set her up for surgery, but she was so scared to do that because she's so young. She hadn't had a baby yet. I mean, even her newlywed husband was just really afraid. And so it became clear when she came across by chance a social worker with palliative care. And once they decided what her life goals were, it was very clear that surgery was not the best way for her to go, and that other treatment was probably going to allow her to continue to lead a very avid and active life. And so these are, again, just some of the wonderful benefits of getting palliative care and getting that palliative care early.
Mhm.
Lisa, I do have a previous question from our audience. Are there any pediatric GI doctors at any of the East Hawaii clinics?
We do not right now have any pediatric GI doctors. I'm sorry.
It's okay, thank you. I also want to ask, I know that palliative care is being offered at Hilo Medical Center, and we talked about access to care. Will that same specialized care be offered from the rural health clinics as well? I'm just thinking about the growing population in Pahoa. Is there a system that can identify the need for care?
So I think that's a great question. And I think palliative care is important in all levels, in every aspect of if you're diagnosed with something, significant. And one of the benefits about our rural health clinics is the key component that we have primary care providers there, right? And so they're family practice physicians, and they treat the full spectrum of the patient. So they're here to be supportive, and they can start those conversations with the patients early in the outpatient setting to, refer over to palliative care. So one of the benefits about being part of a system also is that we share our information throughout the entire system. So if a patient is having a discussion with their primary care provider about, say, advanced care planning, that's something that we can document in our EMR, and it's shared throughout our entire system, and all our caregivers can see that. So if the patient was to come back into the ED, another outpatient visit, go to long-term care, or be admitted to the hospital, we're sharing that information with all the caregivers. So we're making sure that we're following the patient's plan. As for the, do we have a system in place right now for Pahoa to identify those patients? We don't at this time, but I know that Hawaii Care Choices has partnered with a community provider, and they've trialed a system that can identify patients ahead of time and sort of project where they are in their disease process, or if they need any additional type of care. And it's helped, I think, primary care providers identify those patients and get them a referral to palliative care sooner. So I've talked to that community provider, and it seemed like it was a great success for her. So we're also going to be launching that. And I think probably by the end of the year, we should have that system in place as well, so that we can identify patients ahead of time and get those referrals sent off earlier.
Awesome. That's so exciting to hear. Thank you for that. Coming up, we have a quick brain teaser. All right, so up on your screen is early patient sign up ensures more support and quality of life for all. True or false? Again, if you are watching on Facebook Live, you will not be able to engage in our post, but please submit your answers right there in the comment box. Everyone is welcome in the fully engaged Zoom presentation. Next month, email me, llopez@hawaiicarechoices.org You could also visit our website, hawaiicarechoices.org/healthcare talk story to register for the Zoom. All right, I'm going to end the polling right here and share the results. 100% of you said true. Early patient sign up ensures more support and quality of life for all. Thank you so much for engaging in our polls. And I'm going to get it over. Oh, how am I? IT issues. Back to you, Lonnie.
Thank you. Thank you so much, Tish and Lisa. So what's great is I just love when people, engage in the brain in our little questions and polls there, because it shows that everybody is listening. So that is wonderful. That's wonderful. So let's continue on what are the serious illnesses that we are currently treating on palliative care. And here they are listed right here on the screen. And all of these are really nationwide. These are considered very serious illnesses, and for the most part, the more common ones as well. We plan to be adding more diagnosis as our program continues to grow. The real focus on palliative care is to try to boost the quality of life that a person has, even though they're living with a serious illness, because oftentimes there are negative effects due to the treatments that cause them pain and discomfort. And by us coming in and providing the education and even palliative medicine, if that is necessary, that's something that the palliative care can do as well. And for the most part, we're really trying to provide support not only for the patient, but largely for the caregiver and the family, because there always is a strain that is affecting the entire family. So when one person has cancer in the family, we really consider that the whole family is going to be reeling from a lot of those negative side effects as well. So we're happy to get in there. And the other thing too is we start to find that when somebody is living with a serious illness, oftentimes it starts to affect their activities of daily living, such as grocery shopping, cleaning the house, just things that they normally do. Sometimes it becomes quite a challenge for them, and so we're really, really grateful that we can get in the home and help all the family, including the patient.
Definitely. Lisa, in your opinion, how are the East Hawaii clinics doing in serving the most vulnerable, the most disadvantaged population, including the homeless? I know you mentioned Ka'u's initiative, but is there any others?
Yeah, I think we're doing, I think we're doing an okay job, but we have a lot of initiatives this year to really expand on how we're dealing with this. So back in 2018, I think it was, we piloted a program where we brought in community health workers and nurse practitioners in our 1190 footprint. And it really was to focus on looking at those who had frequent visits in our ED and how could we help them better to stay out of the emergency department. And what one of those successes were is getting those nurse practitioners and community health workers into the home, very similar to what you're doing, right? And I think it really did help, and it was something that kept the patients, they felt more comfortable. I think their quality of life was better. They felt like they connected with someone, and so if they had a question, they could call versus immediately going into the emergency room. So we have that in our 1190 footprint, and we just hired a community health worker in Ka'u. So our plan is to expand that same service in that Ka'u district. And she'll be connecting with, there's a lot of people out in Ocean View who don't have or don't even come to our Ka'u clinic for services. So we'll be able to go out to those communities who have difficulty getting or seeking care and providing that. We're also expanding this program too. So I think it's a really exciting time. We have a new nurse practitioner who's joined the team, and that is going to be her focus, is really going out into the home and providing care to those patients who just have a difficulty of getting into the clinic setting.
Thank you so much, Lisa, for sharing that just exciting news. Friends, if you are on this healthcare talk story, you are not going to get this information anywhere else. So thank you so much for joining us. Back to you, Lonnie.
Thank you. Thank you so much, Lisa. We are very excited with the expansion that's happening out in Ka'u. Our liaison, Adrian, has already touched base with your community health worker. We're so excited that those expansions are happening and that we can go hand in hand together. I'm sure we're going to cross over with your APRN that's out on that side too. And you know, the things that we can do together versus alone is just going to be amazing. So we're looking forward to working with that team. In fact, your Ka'u team is just so wonderful. It's like we've seen them for years, you know, that's how warm that team is out there. So back here on how does palliative care work at home, I think a lot of people don't realize that we would actually come to their home and really put the patient at the center of everything that's going on, particularly with the goals of care plan. So everybody on the team, including the caregivers, will understand what the patient's life goals are based on their values and priorities. So like I was sharing in an earlier story, that the person who was going to be scheduled for surgery because of her cancer, she was an avid cyclist, and had she taken the surgery, she may not have been able to ride bike ever again. So based on her life goals, then the goals of care were created. And that is the beauty of the collaboration between the palliative care team and the physician and the entire team that's on there, because we're able to then work together to try to manage the person's pain and any type of emotional discomfort they may have. And it's really great to then connect the caregiver and the patient to community resources that maybe they would not be they wouldn't even know existed had there not been a palliative care team to surround and hug them. And it's really nice too that, you know, there can be an advocate, which is not necessarily always the caregiver, but an advocate such as somebody on a care team that can go with them should they need that to a doctor's appointment, so that a lot of times we can educate and explain to them, okay, this is what just happened in the doctor's office, so that they can understand that this is what to expect about their disease progression. This is why they're taking this certain type of medication, and all together it's such a win-win, because their quality of life is immediately impacted in a positive way by just having this education.
Lisa, we have a question from our audience. Are you looking for more nurse practitioners that can go in the home?
Yes, we are looking for more nurse practitioners that can go in the home. We have initiatives in 3 of our different clinics right now, and we're trying to recruit for those nurse practitioners. Yeah, so in the Hilo footprint and also in the Ka'u footprint.
Wonderful. Thank you so much for that. Also going back to access of care and just resources, there are some challenges, and that may be different from rural clinics versus, you know, maybe Hilo Medical Center. Can you tell me a little bit more of the challenges and the differences between rural clinics and the Hilo Medical Center in serving populations?
I think I talked a little bit about it earlier, but I think one of the biggest challenges, if the farther you out you get, the more the difficulty you have just for getting any type of support around you. And for patients to come into town, I mean, transportation is just one of the biggest things that I hear, that people just don't come in because they have such a difficult time getting into their appointments. I would say another challenge is we don't have a great infrastructure when it comes to, you know, internet access for the entire island. So we have the ability to provide telehealth visits in all of our clinics and all of our footprints, but it is not widely accepted. And I think part of it is just people don't have a place to get on the internet and then see their provider via a telehealth visit. Some of them you have to come in and you have to have that hands-on, but there are a lot of appointments that could be done virtually too that we're not tapping into just because we don't have the infrastructure to support that right now.
Definitely makes sense on that. Thank you for sharing. All right, back to you, Lani.
Thank you. You know, that's a really good point, Lisa, about the telehealth side, and that a lot of people don't have access to Wi-Fi, because we would have patients driving to McDonald's and other things to try to get on, to the Wi-Fi. And it is really a challenge to try to do that, especially because our more mature population, they're just not tech savvy. And so we are out there helping them. Again, when our palliative care team comes in, we're able to show them, how do they use their iPhone and other things, just to kind of help keep them connected to us. And it is wonderful to be able to work with others in the community that are providing healthcare, so we can keep our community healthy. Now, speaking of other resources within our community first, if there's somebody that isn't on any of our programs, we really highly recommend that anyone that doesn't have an advanced healthcare directive, please contact our friends here at Community First, because they will not only provide the education in one sitting, but you would actually leave with a completed advanced healthcare directive. So, and it's free, it's completely free. So we largely suggest that people who don't have one, possibly on this call, or maybe loved ones that that don't have one, please encourage them to contact our friends here at Community First to have it done. This is probably one of the most precious gifts you could give to a loved one, because this directive will provide the directions to a loved one should you or a loved one not be able to speak due to illness or something else that's happening. So yeah, we've actually seen people in this quandary where the family doesn't know what to do. Lisa, have you seen that over at the hospital as well, where people aren't sure what their loved one wants?
Yeah, and I think it makes it so much easier when they have an advanced healthcare directive. So at least the families know what the patient wishes to be done, so it makes it a lot easier for the families.
Yeah. Back to you, Tish.
Thank you. I put that registration link right in the chat box. Please feel free to go. They are wonderful, wonderful ladies, and it is truly a gift to your family members with it as well. All right, back to you.
So for people, when it's time for hospice, I think a lot of people are not really clear, like, oh, when is that? But it's really when the patient is not eating anymore. They don't really want to drink anything. They're in bed a lot. It's difficult for them to get in and out of bed. They're less and less independent. I think almost not independent at all. And, even taking a bath and all of those things are really challenging. Definitely, it's probably time for medically directed comfort care. And you might hear that term of comfort care, and it is the Cadillac of services for sure, because hospice care comes with a very, very robust program of benefits to the patient and especially the family. And this is the part that is really important to know, that people should not wait. If their loved one can qualify for hospice care, by all means, definitely sign up, because the family benefits hugely from hospice care coming into the home. And the things that help a patient qualify is, of course, their physician certifying that they probably have a life expectancy of 6 months, and they are no longer benefiting from curative treatments if they were taking them. And what happens too is, I always tell the physician that a really good indicator is when the caregiver comes in with a patient and the caregiver is looking very frail, that is a clear sign that relief and support is much needed at home.
Lisa, at the rural clinic, the Ka'u Hospital, Hilo Medical Center, I'm sure there's so many patients who are terminally ill that need hospice care to get comfort directed care. Is there an effort to identify those patients earlier?
Yes, that goes back to the system we were talking about. We are working on using actually our EMR and lots of patient information to identify those patients ahead of time, and then get them into not only immediately into hospice care, but can we get them into palliative care earlier so their transition over to hospice care really is a smooth process for them. Because a lot of times patients, they're very late to engaging with hospice, and they don't have a lot of time, and they have gone a really long time without a good quality of life, honestly, and they may not have been comfortable. So we're hoping to use this tool to identify those patients, get them in actually earlier, get them into palliative care, and then when they need to, then transition over to hospice nice and smooth.
That is so awesome to hear. I know Lani and I were always talking about, I think maybe culturally, we just don't call the doctor soon enough. We'd like to wait until like the absolute last minute. But then at a lot of times it becomes then a crisis and, the families are like, oh no, what are we going to do? So it's so great identifying and having that tool to identify so much earlier. Back to
Yeah.
you, Lani.
And it pulls in information from all different areas of care too. So if the patient is going to the ED, sometimes the PCP doesn't get that notification if it's coming from the ED, or if they've gone to an urgent care, or they're seeing a different type of specialist. This system actually pulls all that information together and then identifies those patients, and then their primary care can look at it and say, yeah, this one is a good referral over to palliative care.
It's so great that everybody's it's getting more connected, I feel, right? Awesome. All right. Well, we are going back to you, Lani.
Okay. And, I really applaud you folks, Lisa, for being so ahead of the game and just jumping on this proactive tool that will allow us to access so many more people. And that, sadly, right now, the average amount of days that somebody lives after they go to the hospital and come to us is just a handful of days, and it's really difficult because by the time they go to the hospital, they probably could have used that care long before. And that's why it's so exciting to hear that you're going to start with Pahoa already, which means that if we're able to just get in there and help them before they even have to come to the hospital, I mean, what a win for the entire community. And so I applaud you guys so much for just being so smart and on it, to get this done, because we'll be able to then get people in early and give them the care that they need. So with regard to providing hospice care, which is a subset of palliative care, which is a very large umbrella, hospice care is different with regard to palliative care because people are no longer seeking treatments. So that's something that's quite different. Also, they get the certified prognosis of 6 months. But also the benefits of hospice care is, besides having a very large team, meaning besides the registered nurse, there's also the APRN that comes there, there's the home health aide, there's the spiritual counselor, there's also trained volunteers who, I have to say, do a magnificent job, because a lot of times many of the hospice patients want to stay with us because they absolutely adore their volunteer who stays with them. They play music together, they play checkers, or they go for car rides to the beach, all kinds of things that just really build on the comfort of this program. And that other things such as the medical equipment and the medications and oxygen and other things, all associated with the diagnosis, is all included, and that people will no longer have to do visits to the doctor. That, many people suffer by the white coat syndrome of their blood pressure elevates just because they have to go to see the doctor. All of that goes away. And it's, as you said, Lisa, when we're able to see people in their homes, they're by all means so much more comfortable. And it is completely our honor to do this type of work.
Lisa, I had another question. We know that Medicaid is hoping to launch a palliative care benefit across the state this year. What percentage of Medicaid or Quest patients are served across Hilo Medical Center system, and how will that affect their access to palliative care?
So at Hilo Medical Center, I think our Medicaid population is about 30%. So if this actually does go through, it's going to allow a lot more resources for people to get palliative care earlier and faster. So I think it's actually going to be a benefit if they are going to push this through for our Medicaid patients. I think it's going to force all of us to provide more services to the patients, and I think it's needed. I think patients need to have good quality of life and be comfortable in their home and be educated about what's going on in their life. So I'm excited for it if it does come through.
We are all excited for it too. Thanks so much for sharing that, Lisa. We have our second brain teaser up on your screen right now. How is palliative and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, or all of the above. And those of you watching on Facebook Live, you will not be able to engage in the polls, but please send your answer using that comment box. We'd love to hear from you. You could visit our website, hawaiicarechoices.org/healthcare talk story, and join in on our Zoom next month. All right, I'm going to end the polling right here and share the results. So 100% of you said true, or excuse me, all of the above. Yay, thank you so much. All right, we are going to head right back to Lani.
It's really cool that you just talked to Lisa about the Medicaid population, because that will affect how they get access and be able to pay for palliative care in the future. And hopefully that does come through, because I agree with Lisa, it would be great to have more people get this kind of care earlier and be able to afford it and pay for it. So that's wonderful that that's going to happen. For palliative care, most of the insurance companies will cover palliative care like a specialized doctor visit. So somebody might pay anywhere from $15 to $25 for a visit, unless they have a second insurance, where sometimes people have Medicare and Medicaid, at which point then there is no copay at all. For those that are receiving hospice care at home, it is covered by 100% for on Medicare, VA, most insurance companies, Medicaid, HMSA, all of that. And so it is such a wonderful benefit to have and know that you could get all of that and still afford it, because for most people, they've already paid for it.
Right. Thank you so much, Lani, for just discussing about palliative and hospice care. Thank you so much, Lisa, for just sharing all of your insights and the exciting new things that's happening on our island for our community. Thank you so much, audience, for listening in this morning on our Healthcare Talk Story. Just wanted to let you know that you could call us or ask your physician if palliative care is right for you. Feel free to call us at 969-1733 Monday through Friday, 8 to 4:30. You can also email us with any of your questions, care@hawaiicarechoices.org, or visit our website, hawaiicarechoices.org. There is so much information, and we also have a very helpful team standing by that will be happy to answer all of your questions. Our hope is that you get the right care at the right time. So at this time, I would like to just do a quick short survey for those of you joining us on Zoom. There'll be a quick survey that will pop up on your screen. Please make the selection that you think is best for all 6 questions and then click the submit button below. This survey will be anonymous. It will not be shared. Just Lonnie and I would love your feedback for us to improve presentations like these in the future and getting more wonderful guest speakers sharing information that you can only hear right here on Talk Story. For those of you on Facebook, please send your thumbs up, your hearts. If you enjoyed this presentation, send a mahalo to all of your guests as well. Again, everyone's invited to the Fully Engaged Zoom presentation on the 10th of every month at 10 o'clock. So that survey is coming right up on your screen now. And while they're taking their surveys, Lisa, I'd like to ask if you have any last comments, any suggestions that are listening, or excuse me, to our audience that are listening right now.
I'm just so thankful for the opportunity to show all the great things that we're doing, I think, in this East Hawaii community. I know I'm a local girl. I'm born and raised here, so I know what we do impacts my family, friends, neighbors, everyone around me. So I appreciate your support too, because I think we do cross in a lot of things, but it really is for making the patients and making our family members more comfortable in their time. So yeah, thank you.
Definitely. We had one more question that came from our very eager person to share, to participate in our community. Where should they contact or who should they contact if they'd like to be a nurse practitioner?
Oh, that's exciting. We have a lot of openings. Yeah, they can actually contact, well, let's see. I can put my contact information in a chat. I'll send my email address and then they can contact me directly. I'd be happy to take that.
Wow.
Lisa. All right, and that is for Leilani, I believe. So go ahead and see that in the chat and connect with Lisa. That is so exciting. Mahalo for that. Lani, are there any last words or anything that you'd like to share with our audience?
Yes, I just had another question for Lisa. And oh my gosh, Lisa, you just made somebody's day by sending them your email. That's wonderful. This is what we love about Talk Story. Talk Story is like having a front row seat to a backstage pass, because for the most part, nobody actually is going to be able to ask you questions directly like we're doing right now. So we feel so honored and privileged to have you. So one of the questions I have is, I wanted to know, why do you think physicians don't like to have the conversation with patients to help them get access to care earlier? What's your thought about that?
Why they don't like to have, it's an uncomfortable conversation. I think even as family members, if you're trying to talk to your loved one about what is the next step, it can be difficult. It's a difficult conversation to have. So I think sometimes people don't know when it's the right time to have that conversation as well. So I think with all of these new things in place, we're going to be able to identify patients and be able to have those conversations early. And I think the referral over to Hawaii Care Choices is going to help us as well, because you will also be contacting those patients and having those discussions right with the patients, and it's going to be supporting everybody around. So I think it's a difficult conversation to have, but it's one that's necessary.
Yes. Yes, you're absolutely right. And we love linking arms with you folks, because by using the tool that proactively identifies these patients, we are definitely that conversation pro, and we will help you folks. Once that referral comes to us, we'll really dig in there and help to do those difficult conversations, because that's something that we're very well versed in at this point. So happy to hear that. Thank you so much. That's all that I have. And thank you again, Lisa. You are a rock star. Thank you so much for coming on our Talk Story.
I see that Dr. Walker put Chantel's contact information. So she is a provider recruitment specialist. So if anybody has anyone seeking any opportunities for nurse practitioner or just providers in general, you can send them to Chantel and she'll be happy to connect you.
Awesome. Awesome. Great.
It's so
Yay, Dr. Walker. That's incredible. In fact, I have to now just seeing Dr. Walker's name, I'm thinking, oh my goodness, I have to call her for, the in-service for the new team. We always like to keep everybody updated, on the floor. So thank you. Thank you again. Tish, is there anything else?
Nope, I just like to say thank you so much to everyone. Thank you for submitting in that survey. If you feel that you have benefited from this talk story, we welcome you to join us again next month, the 10th at 10, and share with your family and friends that they can join us as well on Zoom and on Facebook Live. Lisa, thank you so much for everything that you have shared and even the connection that was made today from just the community. We are so, so grateful. It was fantastic. Everybody is saying that we are just so thankful. Mahalo nui, really appreciate the talk story. Lonnie, Dr. Walker is looking forward to the presentation.
Yeah, yes. I tell you, me and Dr. Walker, we go way back. We go way back. It's awesome.
Absolutely. Well, I wish everyone a beautiful Aloha Friday. Ahui ho, malama pono. Until next time, take care. Aloha.
Aloha, everyone.
Bye.